To the glory of God, and most importantly also towards effective and impactful health reporting that will help act as a pathfinder towards taking healthcare to the next level. We here collectively launch the competition has been open now, and also launch the website of HALA Nigeria. Thank you very much.
My name is from the Nation newspaper.
Welcome.
Kazim Achinity is my name, from Voice of Nigeria.
My name is Charles Kalu, Radio Continental.
My name is Charles Ogogen, an independent newspaper.
Camillus Okejubu Naji is my name, New Telegraph.
My name is Ayo Ilori, Radio Lagos Eko FM.
My name is Shola Balogun, Eko FM.
Ifoma Okbala, Metro FM.
I am Ulufen Fulani, Radio Nigeria.
Bingo Fatide is my name, Radio 113.5. Radio Academy, sorry, just joking.
Nigerian Academy of Science.
Okay, so my name is Cece Fadupe, and I am a Knight International Health Journalism Fellow, and I have 3 colleagues here. Tunde Apeji, please come up. Olusegun Odimbinde, please come up. And the man of the hour, where is Declan? Declan Opala Ike, please come up. And we are the Knight Fellows and the team for the HALA Nigeria project. And we're all happy that you are here today. Would you like to say hello?
Hello. Yeah, hello. That's what I would say. I'm happy to be here today. This is like a climax of what we've been doing for the last 3 months, through the kinds of surveys, trainings for journalists. Thinking through how to embed innovation fellows in newsrooms. I'm so happy to be here with the caliber of editors that I have here. Like an accidental journalist. I always be like a tech person, but I'm so happy to be in this space. Thank you.
Good morning, all. Still morning. Yeah, Tunde Akweji, as you mentioned earlier. For me, it's a pleasure being here, considering that I'm supposed to be in the Greeks. Talking with citizen journalists. Welcome.
And this is Declan Opaleke.
We thank you all for coming. We know editors are very busy people, and we really truly regret starting late, but we keep expecting other people to quickly join us. For now, we are going to hand the microphone over to Dr. Pitan, who has a few things to say to us about the critical role that we play as journalists in pushing the agenda for health. It's not a prepared speech. Dr. Pitan is somebody who is very attuned with communications and knows, like he always says, how important communications is to health. The whole idea of the HALA Nigeria project is about that, the importance of communications to health. So we're going to kick off with the brief remarks from Dr. Pitan, and then we shall then go properly into what this project is about and what this story challenge is about. So I am going to hand over the microphone to Dr. Pitan and hope that it will work, the microphone will work for a bit while we try to get it fixed. Thank you.
Good morning, ladies and gentlemen. I want to... The other mic is better. Hello? Yes. That's investigative journalism. I say good morning. I'm very happy to be here. And my relationship with Declan and the number of people I can see here dates back some years ago. And what brought us together then is also what we are doing today. Essentially, is to not only identify the critical role that communications and therefore journalists play in terms of effective healthcare delivery, but also to be able to start working on improving their capacity through various strategies to be able to actually make them assist the community in getting effective healthcare coverage. And there are so many ways that this goes on. Essentially, it's about investigative journalism. It's essentially about discovering what is going on at various places where there is no coverage, where there is coverage but it's being poorly delivered. Also, to make sure that governments are transparent and effectively utilize resources available, even where those resources are not adequate, but at least that they are maximized for effective healthcare delivery. When I came in this morning, I also saw my Executive Secretary, Nigerian Academy of Science, Dr. Dubanjo, and my joy knew no bounds, in the sense that at that academy, I'm also serving on a committee that says Committee for Evidence-Based Health Policy Making. So you can see that such things, along with what we are doing today, they will go together. In terms of health policy making, using evidence, that evidence may be research-based, may also be findings by an investigative journalist. I will give you a few examples. For instance, when you talk about insecticide-treated mosquito nets, journalists could investigate whether those things are being provided at all, and if provided, are they getting to the people? And if they are getting to the people, is it effective on the ground? All right? Is it effective on the ground? Naturally, Nigerian Academy of Science too will be interested in that through the Committee on Evidence-Based Health Policy. A health policy has been made that insecticide-treated mosquito nets should be used, should be procured, should be widely distributed, and so on and so forth. But probably through a collaborative effort of investigative journalists in the health sector and, for instance, Academy of Science and researchers, you may discover that people are not even using the nets. They will take quite all right. They may be procured, they may be widely distributed, but people may not be using because of heat. When they sleep under the nets, they feel very hot because of our weather, and you know what it is with power here. And so there may be need for other things to come in. And so when investigative journalists that are empowered, trained, discover such things, they feed back to the policy makers, and a change will come in. There are so many things that journalists can help us attain. I was also talking to Declan and his colleagues here that even there are ways in which primary care, which by the way is 50% health communications. Primary care is 50% health communications. You can then imagine what journalism and investigative journalism at that could help us do in attaining effective primary health care. One can go on and on and on. There are discoveries through ordinary observations by some journalists that work with such institutes that make us know that mosquitoes from certain areas don't even carry malaria. There's a lot of mosquitoes in this area, but the people there are not having malaria. Why? Then that sets the researchers thinking. Then they go on and discover that it's because the mosquitoes there don't carry malaria at all. And it is mosquitoes from certain other areas. And I'm talking about this, you're very Lagos. I'm not talking about somewhere very, very far. That mosquitoes from certain areas carry malaria. So that when you want to talk about fumigation, you know where to concentrate the efforts in. I can go on and on and on. Essentially, is to showcase or highlight the role you have to play for effective healthcare delivery. I welcome everybody. I congratulate the 4 mosquitoes who, don't let me say mosquitoes now, mosquitoes, for the wonderful efforts they've been doing. It's a wonderful thing having a lot of big fishes in the media industry here, editors. I'm sure this collaborative effort is going to yield very effective results. Thank you very much and welcome.
Thank you very much, Dr. Pitan. Essentially now, we're just going to introduce to you what the HALA Nigeria project is exactly about. Then before we go to talk about the competition, and then we go to lunch, because it's a very short process. We know that editors are very busy people, we don't want to keep it for so long. If you open Nigerian newspapers, and any newspapers for that matter, across the world, or you tune it to the television or radio or something, particularly if you open the papers online, and you go to the comment section, it is most likely that if you find a story that is political, or about business or sports, or about, romance, love, whatever, and you go to the comment section, you're most likely to see 50, 100, 500 comments. Nigerians will engage each other in those comments. They will engage the reporter who wrote the story. They will abuse the officials who are reported in the story. They will engage the people. What it shows primarily is that Nigerians are interested in the news. They give feedback. They may not be correct in what they're saying, but they are passionate about what they say. And they say them in very strong terms. But if you go to the same newspapers, and you go to the health section, and you read through the health stories, they may be very well written, very well presented. If you go to the comment section, you are most likely to see 0 comments, 1 comment, 2 comments. Why is that? It is precisely because of that and a few other reasons that we thought that HALA Nigeria is very important. Because we know that health is very important. It's critical. At least our people say so. Some of you may be conversant with My World, which is a wing of the United Nations that just does surveys. All they do is surveys. And in a recent survey, where they surveyed people across the world, they asked people, what do you consider your most important, what are your most important needs, or what do you care about the most? And they had a long list of items. And overall, health ranked number 3. Nigeria was also surveyed. If you zero into Nigeria in that survey, health is one of the ones on top. But then why is it that Nigerians do not comment or react? Why is there no citizen voice in the media in matters of health? Why is it that when their voices actually they are stifled, they are really few? That is why we thought HALA Nigeria is important. We thought perhaps there was something about the way our health is reported that doesn't make it mainstream. We thought perhaps those of us in this room who are the decision makers in our organizations, perhaps we do not, by the way our own reporters bring the news of health, we do not see the importance of that news item, at least how important it is. So HALA Nigeria was created primarily to educate, to train the journalists, number one, to be able to report health in such a way that they will be able to engage the citizens and get the input, the voices of the people. Perhaps the reason why we do not have the kind of engagement on health issues from the people that we get about politics, business, and other things is that perhaps the journalists are not reporting exactly what ails the people. Maybe when the people are suffering from malaria, the journalists are writing about tuberculosis. Maybe when the people are suffering from tuberculosis, the journalists are reporting fibroids. Everything is important, but what is more important is what affects the people the most. So the idea of HALA Nigeria is to redirect the thinking of the media, particularly of journalists who report on health, and the editors who ensure that these reports are carried, to actually begin to engage with the people, to know what ails them the most, what interests them the most, so that we can cover those things, so that we can give them information that is useful to them, information that they can use. That's the whole essence of HALA Nigeria. So when we started this project, the first thing we did was, let us go and ask Nigerians, what is their most important health needs? Or number one, primary health concerns. I'm going to call on Sisi Fadobe, who led the team in conducting this survey. She's going to tell us a little about how we did it and what we found out, what Nigerians said, and why and how we think we should address those things. Sisi.
Thank you, Declan. I think the main thing to take away from our presentation today about HALA Nigeria is that it's about your audience, your listeners, your viewers, your readers. What do they think? What do they want to know? What is important to them? And are you meeting those needs? It's really unmet need for information about health in Nigeria and how we can ensure that the listeners, your audience, really get what they need from you. It's a new model that technology has helped create it. that online and social platforms, online, social networking, Facebook, more people are engaged in government. More people want to be engaged in governance. And the critical link in governance is always the media. We mediate what the leaders are saying to the people. We mediate what the people are saying back to the leaders that they have elected. And in the case of health issues, we communicate to the leaders whether or not what they're investing money into public health is really what the people need, and whether what they think the public needs is in synergy with what people really think. So the focus of this whole entire thing is your audience, your readers, your viewers, your listeners. So if you're keeping them in mind, our project is really very simple. So as Declan mentioned, we did a survey. We had a listening period which lasted from December 4th until now. And the listening period was really to talk to people, to talk to news organizations, to talk to journalists, to talk to editors, to talk to civil society organizations, to see, well, what do you think is important? And how are your communities, how are your constituencies perceiving what you think is important? Are we just telling them because that's what we think is important? Or are we really grasping and really putting into our information that we convey about what is important? So we're delighted to have you here for that purpose, to really help us carry that forward and really bring the people's voices to bear on every platform. As you know now, if you publish a story, you also need to put it on the web. You also need to do a social chat on it. You also need to put it on the radio. And in organizations that are multimedia, meaning that your owner owns both the radio and the newspaper, and you have a website, you have to communicate across all platforms. And so that communication needs to be feeding one another, into each other, and that's what's happened. So the result of the survey that we did, there were 7 questions asked of the Nigerian public. It's done with sampling, and the sample that we used showed that in Nigeria, a lot of people, most people, 71% exactly, feel that malaria is their #1 issue and #1 concern. We also asked them, so if you could advise the health minister or the government about where they should be putting their money, what sort of investment should they be making? The result that we got back was that they need to have more facilities in neighborhoods, that many facilities in neighborhoods aren't meeting the people's need. First of all, as Dr. Leke Pitan has said, basic health is basic information. Do people make a correlation between the gutter that's in front of their house where mosquito is breeding every day and their frequent malaria problem? Have they made that connection? Have we communicated that? And every journalist that I've spoken to about it says, oh, we're so used to seeing that. It's not really, an issue anymore. But it is an issue if collected water is providing grounds for mosquitoes to breed. So those were highlighted. And there was a period when HIV and AIDS was very prevalent in the news. And during that time, the one thing that made the difference was bringing people up who were impacted, whose communities were impacted by this problem. We saw people living with HIV and AIDS. We saw the orphans left behind. We saw the husbands or the wives who were affected. We saw how communities were decimated. The media did that. The media made it an issue. In this particular instance, we're not asking that malaria be an issue. If that's not a focus for you, that's fine. It's health generally. People want to be talking about, how do they improve their quality of life? How do they improve sanitation? How do they improve the well-being of the women who are expecting? How do they get aspirin if they go to a health clinic and, all they have there is condom? I mean, you can look at both instances. How do they go to a clinic that doesn't have enough staff to care for them? That's what people are interested in. That's what people want to engage about. And so we hope that, you agree to some level that, engagement is relevant and it's necessary, and that engagement is also a good business model. It doesn't do you good if people are not reading your paper. The reason you put out your paper every day, the reason you produce your programs every day, the reason you're on the air every day if you're a broadcaster, is because you know that there are people out there listening. But if they're listening and not feedbacking to you and you're not hearing from them, there's a gap somewhere, and that gap needs to be closed. And so we're hoping that through the HALA Nigeria project, we all can come together and begin to close that communication gap between the audience that we serve and the service that we provide. So we're so delighted that you're here to help us take this move. It's really a movement. So it's a people's movement. Take this movement forward. Thank you for being here.
So, in the Niger Delta, we consider the Niger Delta particularly important in this matter because for so many reasons. Primarily, one of them being what the Niger Delta represents to our country in terms of the economy and everything, and in the past, the devastation that we have suffered, and the level of disease and sickness that comes from that environment because of the devastation. So, Tunde Akweji has been working with citizen journalists in the Niger Delta, and he has trained a couple of them, a number of them. He's going to talk about the project and how these people can become even helpful to mainstream media. Tunde Akweji.
Thank you. As Sisi mentioned earlier, at the heart of HALA Nigeria is the idea of citizen engagement. And in the Niger Delta, we've trained citizen journalists to report health issues in their communities. Of course, that also includes environmental issues and poverty issues. When I took on that project, I think I went with that mindset that things cannot be too bad anyway. Let's hear what they have to say. But I was amazed with what these people have to report about their communities, just at mere interactive sessions like this, not following them to the field. And that's because as mainstream media, of course, there is paucity of resources, we are forever short of manpower, even the city limits that we cover, we are not able to move around them adequately, which is the idea behind the Vital Voices for Health or training of these citizen journalists. They live in their communities, they know what health issues to come up with. For example, in these communities, mosquito nets were distributed. As many as 4 different citizen journalists from different communities, not the same state, not the same local government, had stories to show people who converted their mosquito nets into something for fencing their gardens. Some people use it to fence gardens. A lot of funny uses they put mosquito nets to anyway. So this tells us that there are stories out there. And these citizen journalists are resources. Because they've been trained, they are not just that citizen that's calling you to raise alarm. They know things to look out for. And these are people we can tap into. We've trained 62 of them across communities in the Niger Delta. Of course, the entire 62 may not meet your bill, but then the ones who will meet your bill are able to provide you with resources or to educate details about stories. The picture you have there is one taken by one of them, because we equip them with mobile phones to do the work. And you can see the kind of places they have access to bring you stories from. These are children swimming in water polluted by oil spill. In terms of health, a lot can go wrong in this regard for the children. Another picture still from the Niger Delta, submitted by this citizen journalist. So now, in the case of this picture, for example, they draw attention to the fact when people are sick, no health facilities in that community, and you want to get that person to the next village or town for treatment, these are the kind of roads you'll be taking someone over in an emergency. And when you talk of source of water for drinking, is this kind of punch. So for those of us who want stories from these communities, the resource is there to just tap into this network, and you can really hear from the people at the grassroots, you hear from those who are feeling the situation on ground.
Thank you. Finally, I'm going to invite Sheun Onigbinde. Sheun Onigbinde is an innovation fellow. What he does is to bring all these things together, use technology to disseminate the news and the information, train journalists on how to use technology to do their work better. And he's been conducting something that he has a name for every month, and he's going to talk about it very briefly.
Okay, great, thank you. I'll just talk about briefly. Sorry, I have a mark and it's not compatible with what I'm seeing here. My name is Sheun Onigbinde. I'm an ICFJ 9 fellow, and we've been doing some creative sessions with journalists since January. We have had 3 sessions in Lagos, and we are possibly going to have another one in Abuja very soon. And what we do is that we understand the power of data in telling stories. Most of us are aware of the discussion around open data, data journalism, data-driven journalism, and how these things can help improve narrative. There was the time in which it was always a top-down level of narrative, where whatever you say in journalism was always long. But because of the abundance of information on the internet, people on their own constantly do fact-checking, constantly find out that if these stories are really, really true, if this is objective and this is balanced. And that's why a lot of discussion is going around that we need to put data, we need to use the data should clearly show that this is the reason why we are driving this conclusion, this is why we are making this point. So we are onto a new stride of data journalism, which is a global effort. And if you check websites like New York Times, Guardian, UK, and other top international media, they have desks for data journalism for creatives, people who use graphics, people who use interactive applications, people who use mobile phones or mobile applications to tell stories better. They do it in an awesome way. And this is something we have decided to start out with the HALA Nigeria Night Fellowship Project, in which every month we have what we call the Hackers class, which we call journalists, get developers, we bring them up into a round table and think through how can we make life simple for journalists. How can we build solutions that make it interesting for journalists? And we do this every month. One of the first things that we try to, first thing we did in January was what we call the data wrapper application. And when I come back again, I'll show us, when I'm doing the demo of the story challenge, I'll show us what data wrapper will do. The data wrapper challenge, in which, as a journalist, you can add a lot of data in your story. And you can quickly, in not more than 15 minutes, build a chart, a graph, and an application that is easy can be embedded into your story. They can tell your story in a more interesting and a more better format, a creative and a better format. Just last week, we had a class again in which we pushed Infogram, also a product where you can create infographics and intelligent applications. Now, this is leading us somewhere that in between the HALA Nigeria project, we would have what we call story camps, where we would sit down with, we'll have story camps. We'll have story camps where we'll sit down with journalists and we'll think through how we can best present their stories or submit their entries. In between that, after that, we have what we call innovation fellows. So we get a group of techies or developers who will sit down in newsrooms with journalists, who will look at their challenges. Maybe it's data gathering, data collection, workflow processes, maybe it's on a mobile application, it's a web application, and build something that is sustainable for the media organizations. So this will be fully funded by the HALA Nigeria initiative. So that's why journalists are very, very critical to us, newsrooms are very critical to us, because we want to push the whole evangelism of data-driven journalism, and now we can all make that awesome. Thank you very much.
There are things that your reporters, your correspondents can, they are the ones who've been coming to these classes, that they can begin to use in the newsroom. But it is important that you know about them so that you'll be able to properly channel those energies and the use of those things to make your new spaces more attractive and even better. So, without wasting much time, the major reason why we're here today is to launch the story challenge. Having conducted the survey that we did, having found that Nigerians are really concerned about health issues, but also having found that when you look through the health sections, you do not see a lot of engagement from citizens on matters of health. We thought that one way to drive this engagement is to drive focus to health. And so we came up with the idea of having this story contest that will be built around health, that will focus on some of the things that we found out in the survey, that will give journalists an opportunity to write about that. So we came up with the HALA Nigeria Story Challenge, which we are launching today. We are launching the HALA Nigeria Story Challenge so that we can drive media attention to health, so that journalists can compete for the prize that comes in this challenge, and so that newsrooms, media organizations can benefit from it as well. So the story challenge comes in two major tranches. The first is today we launch the story challenge. So it begins today, opens today. Journalists will apply through that website. And what they will do is that they will pitch their stories. For 2 weeks, they have between now and April 11 to think about any story ideas around health, around them. And it will be fantastic. Editors are the greatest builders of story ideas. If we work with our journalists to say, I think this is a great story, I think we should apply for this story. Now, when we receive the story pitches, we are hoping that there will be lots of them, but we will take the ones we think that will be critical, about 50 in number, that we think will be, properly done, will be impactful. Then, these stories, the people who pitch these stories will then be invited to one-day story camps. If, for instance, you have a story on malaria, from whichever angle, and that story makes the final shortlist, there will be story camps, one-day story camps, where there will be mentors. The mentors can be drawn from this room. We will engage senior journalists, editors like you, along with members of the HALA team, to now work with these journalists, mentor them through those stories, so that they will cover the essential angles, and they will do the stories from the point of engagement. So we will have an engagement fellow, innovative fellow. We'll have technologists working with the journalists to develop that story fully. We want to produce world-class stories that can be replicated anywhere in the world, that after being published in your newspaper or aired on your TV station or radio station, that it can be, picked up by international media organizations. And we can do that. I know we are already doing, many of the newsrooms here are doing great stories, but we're hoping that we'll even do even better, particularly in the area of health. So when we have chosen these stories, we get the mentors to work with the journalists. We get also technologists in that team. Then they will have 6 weeks to produce the stories. After 6 weeks, when the stories are published, then the judging will take another 2 weeks. After 2 weeks, we will release the results. Now, the winners of the contest, all the prizes are on the website, which Seun will show us a little bit of. But what is important, particularly for those of us in this room, she will also talk about that a lot, is that it is not just the journalist who applies will win the prize. The newsrooms will win. They will win because what we have talked about here about engaging, embedding innovation fellows in the newsrooms, we as HALA Nigeria will embed engagement fellows, innovation fellows, IT people in these newsrooms to work with your journalists to use technology to help engage your audience better, using some of the tools that Sean is going to talk about. And all that will be for free. We will embed innovation fellows in the newsrooms for a period of 6 weeks at least. And we will do this across newsrooms where the journalists have shown great potential through the stories that they have presented to the HALA Nigeria team. So, about now, I'm going to get Sean to talk us through the website.
I'll take us through the HALA Nigeria website, what this is all about, what this is doing, and so we can understand the power of what we're trying to do here. The first thing is that we have 4 critical themes in HALA Nigeria. And the 4 critical themes are: 1, storytelling, because we believe that there must be a powerful story for whatever we want to do. There must be a good story with best editing, with the best approach, with the best creative approach. The next thing that is very, very important to the HALA Nigeria, which I think will take a lot of premium, is engagement. Because the HALA Nigeria is many voices, better life. So we're looking for a story that can pull interest of various stakeholders, of citizens, of institutional partners, of people who expect are responsible for this. So audience engagement is a critical component of the HALA Nigeria initiative. The third one is creative presentation. So we think through it that recently global practice shows that when you're telling a story, put infographics, interactive applications to show clearly that the stories make sense, that it could be much more interesting. So we look at that. You see the guy placing charts, graphs. We're looking for those things like that also that can improve story. And for anybody that needs that, my help, as regarding that, I'll be available. This is called to what I do. So anybody that needs a reporter with support about the tools that can help them tell story better, creatively, we will provide that support, even during the story context. The fourth one is sharing. So after the stories have been created, how will they share? How will they use social media, digital media to ensure that those stories are shared on Google, Facebook, YouTube, Twitter, BP, every possible angle that they can digitally make the story very, very viral. Because we all begin to recognize the power of us sharing something things effectively. But most importantly is to think through who can enter for this. Now, we look at it, we have our things that we have thought about as editors. The first thing is this: individual prizes. Editors workshop, I'll talk about that in the newsroom support. But one thing is clear: the story must have that focus for it to even be eligible at all. It must drive engagement in an innovative way. It must have depth and has balance. It must be unique. So it's not like you're reinventing an old story and you're rewriting it. It must be unique. It must be right in the context of the moment, and it must be creatively presented. Those are very, very critical to things that we're doing. I'll show you an example of what I mean by the toolkits that we have. So when we're talking about creative engagement, we have 2 toolkits that we have built already, that we have embedded into the HALA Nigeria initiative. The first one is called info.gram, and the second one is called the data wrapper. And I'll show us the 2 sides and the powerful things that infogram can do and data wrapper can do now. So for the infogram, on Saturday last week, Saturday last week, we had a session with journalists, which we called it of infogr.am or infogram, where you can create interactive applications, small size infographics that can be used to tell your own story effectively. And we want journalists to do this very, very well, because we believe that this is going to be very critical to how stories are neatly and better presented. So infogram can do this effectively. The other one we talked about, which we have had 2 classes on, is the data wrapper class, which is this. So building a simple graph like this, a simple chart like this, a simple graph, a simple chart like this, it's very, very easy and simple. I'll show you a quick example of what an organization I co-founded called Budget did with. Now look at this story. It's titled "Laptop has loves a lot of adverts running." Which says, how often do journalists tell health stories? Now, this is a story someone is telling, and in between the story, he has embedded a neat chart. Can we see that? He has embedded a neat chart, a neat graph, that can amplify that and make that more interesting. So they have built this with what we call the infogram, which makes it very, very easy and clean for him to understand. So it could be a research about measles in an area. You find out that out of 300 people you have surveyed in that area, 150 have measles, 100 don't have incidents of measles at all. So rather than telling that, you can creatively embed a chart and a graph to make that more interesting. Another thing we expect from this when we talk about creative presentation is what we call the data wrapper, in which this is a long narrative about the Nigerian budget, for instance, and there are neat graphs that are embedded in between stories. And these are not very difficult to build. They're not technical to build. If you go to the website, you can get an easy guide about doing this. Just about taking the extra mile and the extra length in doing this. Now, going back to the competition itself, I will talk about the prizes and the newsroom. So after the event, it starts today, which is what we call the launch of the competition, which is on the 28th of March. Then by 11, we curate ideas together, which is going to be the idea submission business. So what's the idea you're putting forward? So we can give you a guide, a mentor, and this would work, and this would not work. So we expect ideas to be submitted by the 11th of April. From there, we now move to the story submission deadline. So we expect to go ahead to the field, research the story more, get more context, get more relevant data to the story, and do the final submission, which is on the 5th of June 2014. And before we now, after 2 weeks from there, we announce the winners for this contest. The winners for this contest would get $1,000 and also other incentives. But the critical incentive will be for the newsroom, as we've said. Why this will be the critical incentive for the newsroom is that we're going to get, for those who, that's why we are not just making this everyone saying, we're making this that we integrate this with the newsroom. We get innovation fellows, fully funded by HALA Nigeria project, to work with editors, to work with journalists in defining where they think technology can support their reporting, technology can support their data presentation, can support their creative presentation. This is what we're doing for 3 months. Innovative fellows in different newsrooms. I'll wait for your questions, for those who have questions. Finally, in between that, we will have 2 things. We have what we call story camps. They are a replica of what we have been doing before, but this time it will be more integrated. So what we have been doing before has been only data visualization classes. But in between these story camps, we have editors, we have those who can also help you in terms of framing your story and creatively presenting it. We will have people like you who can help you with visualizations, using the necessary and improved applications. So we'll have story camps, at least 6 of them, within the Federation to help journalists tell their stories better. So we have the story camp. After the stories are done and after the competition, the winners have been announced, we have an editors workshop which will sit them down, think through the stories with editors, bring experts into the room and help. So the editors workshop will be a special masterclass. Now the winners and other journalists will be invited into. So it's a whole of boutique of support, even after you win the story, even after you get some of the prizes, a whole boutique of support you get from this. It's a lot of partners on the HALA Nigeria, so downside you can see the partners. So the major flagship organization doing this is the ICFJ. We have the African Health Journalists Association, which is led by Declan Opaleke. We have funded by the Bill and Melinda Gates Foundation. And we have other institutional partners who are helping with the tech, and policy, which is the Society for Family Health, Code for Nigeria, ACACAS, and also Declan. Finally, I would say our goal and our mission is to promote top quality stories that can use creative techniques to engage public on health topics that matter to their daily lives, and offer information, data, and tools that can be used to improve their health and their well-being. For more information, so we have the phone numbers of Declan. We have talked about the 4 university fellows that we have, HALA Nigeria fellows we have. Declan Opaleke, the phone numbers are there, CC Fadope. So Declan will be someone who can provide editorial support on this project. CC Fadope is someone that can help in terms of thinking through research, policy analysis, and things like that. CC Fadope. Babatunde Apeji is someone to go to if it's citizen reporting. How do you make sure that the stories that touch the grassroots? We don't limit this down to a single entry per newsroom. We also want to see competition within newsroom. So if, for instance, Guardian, this day, they have 3 journalists each in the same newsroom, we appreciate that. Also understand that we want to get as much stories as possible, as much competition as possible, and the chances of winning that increase. Thank you very much.